Hi everybody, I am Dr. Shaila Sheikh, consultant endocrinologist at Saifi Hospital and Wockhardt Hospital. Today I am in conversation with PharmEasy and we both together are trying to create awareness of diabetes so that we can make the lives of our diabetic patients much easier out there. One, because of peripheral neuropathy, you can have reduced sensation in your feet, you can have tingling and numbness in your feet, sometimes you can have burning in your feet, and these are some of the most common complications that patients come to us with. The best way of preventing foot complications is to see to it that your diabetes is well controlled, because if you maintain your sugars, then you will not develop any of these complications. You also need to inspect your feet daily to see that you have no kind of injury in your feet and to see that you are not caught on your back foot as far as your feet is concerned. Some of the warning signs of having a foot problem with diabetes is that you may notice that there is reddening in your feet, there may be pain in your feet, there could be tingling in your feet. We often tell our patients that do not look at your face, but please look at your feet every day, because sometimes if there is reduced sensation, you may have a cut in your feet, there may be an injury on your feet and you may not even realize that there is an injury, and suddenly some relative notices blood oozing out from the feet or pus oozing out from the feet, and you realize that it is your feet that are in trouble. We also request all our patients not to soak their feet in hot water, which is sometimes a very common issue that we see in our patients, where they feel that if they soak their feet, it would reduce the pain, but because there is inadequate sensation, you may end up actually burning your feet. So please be careful and take adequate foot care. Yes, there is diabetic footwear available in our country and it is becoming increasingly available. We need to understand that diabetic feet are special feet, they need special care, because the pressure areas, if they are again and again subjected to trauma, it is going to lead to an ulcer. So if you can make footwear which can protect your feet and at the same time keep you mobilized, it helps you a long way in seeing to it that you do not have diabetic problems related to your feet happening to you in the future. There are no symptoms per se of pre-diabetes in children, but if you realize that your child is becoming overweight, if you realize your child has become obese, if you see any kind of blackening occurring as far as the nape of the neck is concerned, if you notice any kind of blackening occurring in the crease areas, by the crease areas I mean the inguinal area or in the axilla, then you should be careful, because these are very early signs that this child could be at a risk of diabetes. If you are a diabetic patient, then the very fact that you are a diabetic patient puts your child at increased risk of diabetes, and so you should be very careful with your kid and evaluate your kid with a proper professional if required.